Hi everyone. Hello, good evening, good evening, good evening. Hi, this is Christine Crow here, and I hope that you're all well. And thank you for joining me here today. And I hope that you're having a wonderful, wonderful Sunday and that you've had a good rest for the weekend. I'm just going to grab my tea here. Well, today I want to talk to you about, can we use AI to secure the world's future? Now, what do I mean by that? It's such a strong word, isn't it? To secure the future, for example. And I just want to go into some steps here about the future of AI. It's here. We're part of it. We have helped to create it, even though we may not have thought so. You know, some of you may not have been online or anything like that, for example, but in one way or another, and this is, obviously this is going to create a debate as well, but we've got to really look at what roles that we've played in AI being in our lives today, for example. Now, I'll give you one example. There's plenty of examples, but say, for example, you've used Alexa. Alexa, we talk to Alexa. I don't, but people talk to Alexa, and Alexa, can you put this on? Alexa, can you play this music? Alexa, what is this question? Alexa, Alexa, Alexa. And it's throughout the house, isn't it? But did you know that Alexa also records your conversations? Whether it's a private conversation that you're having, it can record it. And we've introduced it into our house. What else have you got in your house that is AI powered, for example? Let's take our phones, for example. There's Siri on our phones, for example. And when the time when we say, "Hey Siri," and we ask Siri a question, don't we? And what happens then sometimes is you're not even asking a question to Siri, you're having a conversation, and Siri will start talking, saying something like, "I don't understand. Can you repeat that, please?" That's AI. Same with Alexa. When we're talking, and if Alexa is on, then Alexa will hear, and then Alexa will be like, "Can you please repeat that or try and answer the question for you?" Have you ever noticed that? So there's lots of things that we can say that is AI, and it's here, and we've also helped create it. We've got to look at all the things where we've, where mankind, where we've actually, it's an evolution, a revolution has happened here, where AI is everywhere. I can't even think where it possibly may not be. Maybe it could be in a place where it's very remote and there's no internet, for example, but it will be around somewhere in the atmosphere, for example. So these are things that we've said, like when we've been at work, "Oh, I wish we could make that easier," and how can we look at making this easier so that workflow will be a lot easier, it'll be less stressful. So we are the humans that have created AI. I do not believe that AI is going to take over us, because there's a lot of talk about AI is going to take over humans, for example. I believe that the humans will have to learn how to monitor the AI, for example, and to be able to have a job that is related to AI, because a lot of people, their jobs will be extinct. Might as well say it. Probably 40% could not possibly have a job in the next, 5 years, for example. It could be 5 to 10 years. I don't know, because I haven't. This is part of the research that I'm doing anyway, but I'm just talking so that I'm getting everyone to start thinking about what the future holds in your position that you're in, for example. Look, they've got the AI robots that are being released into the industries, even healthcare. Now, healthcare has been a bit more reserved, so it's not as brash, where AI is just totally taken over. Although it is in healthcare, but it is controlled, because it's people's lives, vulnerable people, for example. So with this in mind, AI is in healthcare. It is working with the healthcare professionals, the doctors, the consultants, the surgeons, even in the operations theatre, they are helping, because their hands are more steadier, they've got more precision, they're more laser, they can do things a lot better than what we could do, for example, because guess what? We've given them all that information and they've scraped it from everywhere and they've produced the best answer that can be the solution, providing that the person that's put the information knows what they're talking about. And this is where AI isn't like how we are, because when you're specialized in a certain thing, for example, profession wise or whatever, then you are a lot stronger than what AI is. See, a lot of people think, oh, I can just type in and AI is going to give me the answers. What kind of answers could you come up with if you are not experienced and you type in the wrong question? You'll get back not the correct answer, for example. It will come back as half of it's good and half of it's bad. So AI is as good as the person that's operating and putting this information into the chat GTP, for example, AI, for example. It's as good as what you are. And if you're not experienced, because a lot of people think, oh, I don't need this because I can just ask chat GTP. But that is the problem, is because the answers aren't coming up correctly. So sometimes the answers are wrong, because if you're putting the information in and you don't know what you're talking about, for example, or you may think you do, and then you come back and you get the wrong answer. So we have to be mindful that it's not AI that's going to control us. We're the ones that's controlling. It's the human that's going to be controlling the AI. But the human must know what the question is and what the outcome is that you want to get from AI, so that the answer is correct. You've seen it, haven't you? You've seen it lots of times where people have thought that they've done something and it comes out and it's not even correct. So you have to read and make sure that it is correct. And this is where when it's in healthcare, for example, there's a doctor there, or there's a physician, for example, or there's a surgeon or a specialist, for example, or a scientist, etc. So when the answer comes back, they can also check to make sure, yeah, this makes sense, for example. Yeah, so although the AI and the chat GPT, for example, can be, I call it chatty because I kind of struggle with saying chat, sorry, I struggle with saying GPT, okay, so that's why I call it chatty, okay, and I'm northern, so I'm going to come out with that. So I've just kind of digressed there, apologies for that. So what we really need to think about is the information that we're going to put into the chat GTP. For example, the humans are the ones that has the power, the ultimate power with what you put in there, for example. And yes, there's some weird things happening where the robots, there's robots for doing the work, for example, but there's also robots that are there for relationships and things like that. People are trying out these robots that are, you know, like kind of like a girlfriend or wifey or husband type thing, which I think is very, very, I don't agree with that at all. That's up to you, but I don't agree with that. So that kind of makes me feel a bit cringy when that happens, when I see that on TV. But let's look at the healthcare, for example. They're introducing robotics because they've just been released, for example, to go into the industries that we all know, for example, and they're able to do personal care to a certain degree. When I say that, maybe wash the face, shave the face, for example, if you're a man and you need a shave, for example. So they have to be mindful of dignity, privacy. There's a GDPR, there's a HIPAA, for example, if you're in America. So there's lots of different implications, and that's why it's taken a lot longer for it to be in healthcare, because we got to make sure that everything is as it should be. Because if we're for example, you as a care business, for example, and you're ensuring by policies and procedures are being followed, for example, the same has to be done for the robots as well, so, and the AI. So if you're using this in your healthcare business, then you've got to have AI policies for your team members so that they're aware of how it works and what it's to be used for, what to do if it's not working, that type of thing. So there's all of these things. So I don't believe it's going to replace all humans, for example, but I do believe that it's going to replace quite a lot of people in the workplace, because you imagine you've got all the big firms that, the billionaires, for example, they've got, for example, if they're using AI, then a job that would perhaps take about, it's already in the video industry anyway, but a job that would take probably about 10-15 people, it's only taking one person to do that, and that one person who knows what they're inputting puts all the stuff in to the AI, and then it can generate all different things. It can do art, it can do images, it can do videos, generative they call it. It's like they can do promotional, like a Hollywood type movie you can create with AI. That's how huge it's become. And this is why I was saying to you that you should really be looking at going on YouTube and promoting your business on YouTube, because everyone is going to YouTube. The serious people are going on YouTube looking because they want to learn things, but also you can connect as a business owner with your knowledge of your services, for example. So, let's be realistic here. Let's look at the future, that it is going to be able to, it can predict diseases, it can predict people's health, it can do a lot of things. There's a lot of positives that AI can do to secure our future, for example. Because if they can detect that someone's going to have dementia, for example, 10 years before, then, if there's a way that it can be prevented, for example, medication or whatever it is, because I'm not a scientist, I'm just going from research, okay, the information that I've been reading. And if that can be prevented or slowed down or whatever, isn't that a better thing? Same with cancer. If it can detect the cancer before it gets too advanced, isn't that a good thing? That we get to save our lives, for example, or have quality of life. Isn't that a good thing? So, obviously you let me know. This is just me speaking from, all the reading and the listening and the information that I've been getting. But I do know that healthcare is a bit behind all of the other industries, understandably so, because it's humans, it's the lives here, life and death, as well as other things. So we have to look at the best ways to introduce it. So that's why healthcare is taking it's taken its time, but it's here, for example. But it is how you are going to use the AI. And you're the one that's putting the information in. And this is why you need to look at what college courses, university courses that is AI related. Because whatever you're doing, say if you're doing law, then you need to do, law with AI, for example. Combine it so that you've got your job, for example. Okay? So that you're operating the AI. It will I believe it's going to make people's lives easier, because we have worked hard, but, at the end of the day, what does that mean? Make our lives easier? We won't really know until 10 years from now, for example. But like I said, at the moment, it is helping to do predictions for diagnostic for disease. So there's systems, AI systems that analyze medical data like imaging labs, the ERH records to predict conditions such as cancer, heart disease, diabetes, and a lot earlier than the traditional methods. So there's, we've got personalized medicine that can be introduced. It tailors treatment to the individual patients by analyzing genetic, lifestyle, and clinical data. It's not just going by clinical data, it's going by all of the other things. It's analyzing the whole picture, your DNA, everything. There's integrated AI with precision medicine as well. I'm introducing this week with my virtual assistant. I'm doing a special beta with them, which is AI powered healthcare assistance supporting with administrative tasks like scheduling and patient engagement, for example. So we're just going through that training, for example, for the healthcare industry, because it's not just about picking up a phone, or it's not just about doing a graphic. It's not just about posting on social media. It's a lot more than that. Healthcare is so much more than that. That's just very generic. I want to be specialized as a virtual assistant agency, and yes, we're going to have chatbots because we need to make things a lot more easier, for example. So look at how you can use this for, if you're going to have virtual assistants. I mean, we are a virtual assistant agency and we specialize in healthcare. Okay, so if you do need assistance with any tasks, then reach out to us. We cover the UK, we cover America, we're worldwide. We cover Cyprus as well. Okay, things like scheduling, patient appointments, insurance, just checking through things, engagement, just making sure that we've got all the information ready for the client, for example. And also the HIPAA compliance is important. So that is something that we work with the clients that are in hospitals, for example. There's also automation of the administrative tasks, that the virtual assistants will streamline repetitive workflows for your organization, like billing, coding, appointment setting, reducing overhead costs. And I'm pleased to say that I'm able to do that. I do come from a teaching background. Before I even started becoming a coach, before I even started my healthcare businesses, I was a teacher for Brighton Polytechnic College as well as Chichester College in the UK, for example. And I used to go into the hospitals, into the lecture rooms to do health and safety, supervisory, healthcare, where the NVQs, in America you call it the CNA, Certified Nurse Assistant. When those accreditations started, that was part of me training organizations and their team members, like the healthcare workers, as well as the management staff for health and safety. I used to do assessments and things like that. And I also used to go into the college, and I also used to go into the hospitals weekly to meet with the students to talk about what I taught them with the workbooks. So, this is my background, where I was before I started the healthcare. And like I said, I went into healthcare organizations and was helping them with their policies and procedures and their inspections, for example, and things like that they had to go through in care homes, for example. And I would go into home care organizations as well, help them with their policies and procedures, for example. So that's where I really did come from. So I come from a teaching background, and I love teaching, for example. And this is something that I'm going to be doing with our VAs. I'm going up to a higher level with them than just generic. I am above the generic. We want to be high class. We want to be world class at what we do for virtual assistants, for example. Okay, so the virtual assistants are healthcare specialized, and I'm not talking about social media, because just posting something is a bit different. For example, I'm talking about other things as well. So our healthcare virtual assistance agency, it will align perfectly with AI, and we are going to be focusing on that starting next week, for example, because AI needs to be introduced and we need to get with the modern way of how things are working right now in the other industries, for example. So AI, it is driven, it is remote. For example, you can do remote monitoring, it can do telehealth. Care providers, I would suggest that you look into you doing telehealth, for example. So there's also the monitoring of patients at home, reducing hospital visits and enhancing preventative care. That's going to be the future. It's now. Okay, and a market example is AI is powered. We're using them on our watches, for example, the Apple Watch, for example, the wearables that we use. It's got trackable vital signs you can do. What is your heart rate? What is your pulse? How many steps have you done? What is your, it checks your heart rate. All of these things, it's already here. We're wearing it daily. So it's not like it isn't here. It's already here. So it's even going to revolutionize the education for healthcare professionals as well. They also have to learn about AI, and there's the training pathways and virtual simulations that needs to be done as well. So there's opportunities for you to offer this to healthcare organizations, for example. So you could become, for example, a AI enhanced healthcare provider. Remember I said about doing training? Add some training to what you're doing. Don't just be like a generic healthcare company, for example, home care company. Be a bit more than that. Be a bit more than that to really get in line with AI and the future. Otherwise you are going to be left behind. You want to become specialized so that you're going to be the one that people want to use and people want to go to, for example. And yeah, there's going to be, if you in the UK, for example, there's the Care Quality Commission, and there's the AI. There's going to be questions about, inspections to do with that, and there's just so much that we have to start taking on board as well. Okay, so think about your organization, really looking at your systems and integrate them into your systems. So there are a few challenges, and there's some ethical considerations, but they've had organizations or people, individuals that have been using AI probably for 10 years, for example, and they come from that type of background. So they're the ones that are aware that, the AI can be biased, etc. So that's why they are trying to train the AI to be unbiased and to provide that training. But it has to it has to come from someone that is qualified to know what information to train the AI, because you have to put this information in, and then the AI gets trained about what it is that you want the results to be. For example, then you look at it, you're like, yeah, that looks how I want it to be. You let it know, for example. And I'm just explaining to you some of the organizations that are using specialized people that have used AI for 10 years or more, for example, because it's been around for a long time. So there are strict privacy regulations, like, as we know, the GDPR and the HIPAA is also, they've created a robust data security protocol as well. Workforce disruptions, well, balancing AI with human expertise, like I said, is critical for maintaining trust in healthcare. It's got to be put in by humans that know what they're talking about. You can't just get anybody off the street that has worked in a different setting, for example, or industry, and then they're there trying to input about healthcare when they don't know what, where they're coming from on that. It's not, they've got to be very careful. So that's why it's taken a bit longer for healthcare to really get in line with all the other industries, for example. Okay, so the future business opportunities, and I want to just really talk about this with you, is for you to look at integrating your services by you, the healthcare provider, transitioning to AI driven workflows. And your team and your staff, your management will need to know that. Your care managers, if you're registered with CQC, for example, these are things that you need to start planning for now. Okay, so you also need to do a business plan now that is integrating AI into your healthcare business. What are you going to be using it for? How is it going to be used? What is the benefits? Who's going to be in charge of that? And what are the protocols, security protocols, if there's a data breach by the AI, for example? So think about this very carefully, because you have to, because it's here and we need to be aware of it, rather than just thinking that it's going to go away. So like I said, healthcare is increasing by this year it's increased globally by 30%, and that is quite a big jump. So AI intelligence is a bit slower in healthcare because of all of the complications, because of all of the different GDPRs and the HIPAA policies and guidelines, etc. So that's why it's taken a bit longer, but it's here. So this is according to McKinsey. McKinsey's, they are a healthcare, well, not healthcare, but they do healthcare, and they are a consulting firm. So they're McKinsey and Company. They are a consulting firm, but they are global as well. And whilst healthcare has used some of the structured data for AI, it has had limited success with unstructured sources such as call transcript. So there's been some issues there, and they're trying to sort through the issues, but it is going to be here. So we need to, healthcare providers need to be prepared for AI, because it is here. You've heard the government organizations, they're talking heavily about technology, AI, healthcare. They want to try and see where this can be implemented to reduce the workflow for the humans, even though we may not think so. Okay, so I really wanted to just talk to you about the journey of AI and the future